Hi everyone, Dr. Desiree Howell here, wanting to share a little bit about my style as a therapist. So I am a licensed psychologist providing online therapy to adults in Florida and Pennsylvania. I specialize in working with happy couples wanting to improve their relationship, but also high achieving women recovering from burnout or who might feel burnt out. Like you've been doing all the things right and really achieving things, but feeling overwhelmed, feeling stressed, feeling anxious, tired of not getting your needs met. I am there for you. So with trying not to use much psychological jargon or, letters or the, psychological approaches, because those may or may not be meaningful for folks who aren't a mental health professional themselves. I'd like to just share a little bit about how I think about therapy in my work with clients. So I use, evidence-based, science, but at the same time, I work very collaboratively because I trust in your expertise. You are the expert on you. I will never know you better than you know yourself. I really feel like therapy is not a one-size-fits-all solution, right? That's why self-help books and podcasts and things are really lovely. You can get a lot of inspiration and even really concrete steps out of them. But implementing that wisdom or that support is going to look different for different people, right? Because we're all unique humans with intersecting identities in this society, that influences so much, right? Different obligations, responsibilities, different strengths, different resources. So I love really getting to know someone, helping them feel safe, right? Build that trust, and then collaboratively decide together, what does treatment look like? What do folks need? Especially because we need different things, week to week, right? I'm very open to feedback. I view it as you are hiring me to be your professional mental health, your advocate, to be your guide, to say, okay, you want to change your life. There's some things that aren't working, some things that are working. What do you want to be different? What do you need to heal? What do you need for realignment? What strengths can we bolster? What barriers can we remove or do we need to consider and work around? I don't ever want to presume that I already know what's best or, based on science or based on previous clients, this is what worked for them, so this is for sure going to work for you. That's not how I think about things. So I really want to honor your voice and be open to feedback, right? Because for some folks, it might be like, hey, you're talking too much. Just listen, let me talk, right? For others, it might be, you're not talking enough. Can we really think through concrete strategies? Like, what's one thing I can work on and do differently this week? Because people are going to be in different parts of their journey of what they need and how quickly they maybe feel safe with me and how quickly they trust. And so, being open to that feedback of, faster, slower, more talking, less talking, because I don't want to push people either. People change and grow and heal at different rates. And so, again, I don't know that okay, in 5 sessions, you'll, for sure be, better in this regard or, right? Because we're all coming in with different stories and different experiences and things you've gone through in the past and having different goals for what you want your life to look like moving forward. So with that being said, online individual therapy with me is going to be collaborative. And if you want it to be very goal focused, we can do that. We can be very goal oriented and structured. If you want to say, no, I just want to show up and be my messy, authentic self and just know that someone cares about me, is not judging me, and is going to help me, make changes, whatever that looks like, then I'm here for it. That is my style. So warm, collaborative, supportive, but also not afraid to give difficult feedback. I think honesty is going to be very important, right? If I'm just saying yes and being, too positive all the time, then that also, isn't always the best, right? Sometimes I'm like, hey, what about, let's think through this. If this happens, what might that mean? And what does that mean for you? And how do you view that? And really just, building a life that works for you. I am happy to be that neutral third party, that advocate, that guide, someone who's been through some fire and come out the other side, and using my care and my science and my personal experience to say, all right, you don't have to go through this alone, and you deserve a better life. All right, so if you are in Florida or Pennsylvania and you are interested in working with me individually online in a therapy capacity, check out the link to my website, drdesireehowell.com. Take care, everyone.